Hey, this is Melanie Petro, and we are doing cheek neck lift this morning and lower blepharoplasty. We finished the cheek neck lift. This is the reason that we're doing this. It's this jowl area right here. That's what you can't fix with Botox or fillers or lasers. That's what has to be lifted when you start to see this. And this is a good picture because it looks dark, but this is a shadow cast by this, so it makes it look even darker. People that have submental fullness here, that could benefit from cool sculpting or Kybella, they often think they have a really dark neck too, and it shows up a lot in pictures, and that's when that casts a shadow. So her neck will continuously look dark. So this is the incision, it's all sewed up, and this is how you lift this up so you can see how much better this looks, and how much cleaner her chin looks. And now we are doing the blepharoplasty, just doing a little skin pinch. We pinch the skin up, and I'm just going to trim it off, because when you pull the skin up this way, you end up with more skin that you want to get rid of. So we've been off. She's got IV sedation. Philip's taking great care of her. And this is the little bit of skin that will make such a big difference. And then we're going to laser around her mouth. So we've done one eye, and you can already see the difference. The crepiness and the wrinkledness gets worse when you smile. You can see that over here. Also, there's just a little bit of puffiness, and over here you can see how much smoother that is. You don't want to see a line where the lower lid meets the cheek. You want the lower lid to blend into the cheek. As you age, the lower lid lengthens. When this gets hollow, sometimes we can add filler or Vibella to it to make it kind of better, but when it gets to where there's too much skin, one of the worst things I see with fillers is people putting filler here, and then when you smile, you can see what happens to this spot. It pushes up, and then they get these weird eye lines. So if you've got extra skin here, be real careful let anybody put filler here, because it's not pretty. Then this skin is what we're going to take now, so that she has not this length to her lower lid. Because if you look back at pictures of yourself a few years ago, you don't see this demarcation of here's where the lower lid ends and here's where the cheek is. It just looks smooth, like it does on this side. So that's what we're trying to create. We never want to take too much fat from any of the lid, upper or lower, and we always want to keep it really smooth and really natural looking. The incision, this is the thinnest skin in the body. It heals beautifully. You can see where I have it marked. It's right under the lash line, and it just ends up really, really smooth, and that's a really good example. It's worse when you smile. So a lot of people say in pictures, I feel like my eye closes. And when you feel like your eye closes in pictures, that's generally what it is. So I'm just going to pinch the skin up so I know exactly what I want to take. It doesn't take much. This is one of the areas where it's really evolved. Doctors used to take a lot more. But it's sensitive. I mean, never want too much. Any questions? And a little more local in to make sure she doesn't feel anything. Or anything. So we're going to take this skin, careful to avoid her lashes. I certainly appreciate lashes. it is. We're going to give it to Tish.
Hello.
And we're going to sew it up, and then we're going to do the laser. So we'll show you some more of that. Philip really likes eyes.
It's my favorite part.
Do you have any reason for
It's
that?
an instant lift.
I'm going to dissect this a little. She got a little more skin, so I'm going to play with it.
The before and after this is going to be really good, especially whenever you see how low the back's kind of hung, and then how she's lifted that up. Looks really good.
Tish. So the eyes can make you look tired when you're really not tired. They can make you look sick. The eyes are just, they can look like a lot of things, and you be none of them. So, you know? You know.
Reminds me of like Mr. Potato Head, like when you have your angry eyes on, or
Right.
your sleepy eyes, or tired eyes.
So this
Winona Ryder.
Oh Lord, we don't even want to go there.
I know you don't, but I mean, don't you? A lot eyes are. I mean, and expressions. And a lot of times you see people that have had Botox. Right here, you see where this is, and you can't really put it here because it can pull the lid down, and then this really jumps. So if you have friends like that, don't go there for Botox. It's my pet peeves. Okay, you wanna grab that? The Winona Ryder has inspired me.
Do not do drugs.
Well, I didn't realize she was on drugs. I thought we all look that way, making expressions. I will be doing my Botox later.
So what would you do for Winona Ryder?
I mean, first of all, I'd get her off. They all say she's
Send her to
on.
detox.
I would Botox her and then send her to detox. Because that is a pretty woman that I really like, and she ruins it. I don't like it when people let me down. Gabe looks good when he smiles, no matter what expression.
See, like this lady right here with her upper eyelids, I mean, even her eyes shut, you pull, and there's not a whole lot to pull there. That's why we chose not to do her upper eyelids. She's got great brow position. It's right on the brow bone.
Stacey Perry
Higher.
said she loves watching you work your magic.
Glad you missed that. About to get my hand cut off, pushing Tish away. So here it is, draped. Can you show them that? I mean, that just is the prettiest thing in the world to me. So this is the extra skin. So this is going to come up, and that's what will come out, and that's what makes it smooth. And I won't pull heavy. There'll be no tension when I close it. It'll look closed when it's not. Anyway. Especially people that have pretty eyes. I will say that. I'm not one of those people that people say how pretty my eyes are all the time. But when I see a patient with pretty eyes, like I know it bugs them more because people quit telling them how pretty their eyes are. And women really are the ones that ask you, are you tired? Are you sick?
Are you mad?
What's wrong?
What's
Yeah.
wrong? We had a man say somebody did that to him yesterday though. I was like, I bet it was a girl. But it wasn't. Oh, you gave me a short one. You're gonna have to cut that.
What's wrong? What happened?
Need a long
Will you get another 6-0 mask, please?
So Philip, what are you doing over here?
Monitor vital signs, making sure she's got plenty of anesthesia on board for the procedure, and just doing my documentation. And watching Dr. Petro work for me.
You like my magic, don't you?
I do, I love it.
I wish I was as good with jokes. So we are starting the resurfacing around the mouth, in theory. We're treating these lines. And trying to make, I'm sorry, we've got it too tight. Can you pull that just that way from me, son? And this is how we treat smokers. microns. I'm gonna wipe it and see how it looks and decide where to go. This is like the icing. There's no way to make these lines better. That's 200. 400. 600. It's gonna be about 1,000 to get her right how I want it. And that's perfect. Just gonna get my finger. This is what embarrasses people the most. With those lines. Turn the dimmer up a little. Maybe will you turn the chiller up? So when you see a little bit of bleeding, you're on the perfect layer. We may be blowing cold air in her mouth. She's waking up. She's almost done. This has taken us, how long? About 2.5 hours. She'll get up and feel great. Usually, from anesthesia, like a hungover feeling. The face does not hurt. She has a few more lines on this side, right through here, and so I'm going to add some there. Probably the side she sleeps on. It's also the side in the car that gets the sun damage. Do a little more in her lower lip. I'm adding a little bit of coag to right there. And that just helps tighten it some. I'm going to do a little bit over her nose just to pluck it. Just do this a little bit. She's got these pores. And this will treat it. It'll just make it look prettier. I don't laser over the facelift part. Anyway, that's it. And we'll start letting her wake up. We'll wash her hair. And we'll put a dressing on. And within a week or 2 weeks, she will be wearing makeup and feeling younger and happier, wanting to go more places and do more things. And people ask her, did you get a haircut? Did you change your makeup? All kinds of things. Those are the kind of things we hear, and that's exactly what we want to hear, because that's when this is really fun. And in a minute, we're going to go do my Botox, because one of the riders really gotten to me. So if you want to see that, we're going to do that too.